We'll have Dr. Wasif Khan with us. He is enteric and respiratory infection specialist, infectious disease division, International Center for Diarrheal Disease Research, Bangladesh. So our great round of rock stars continue. We now have Dr. Wasif Khan from Bangladesh. He's going to discuss the experience with ivermectin in Bangladesh. Bangladesh, after the Cali study from Australia about ivermectin, Bangladesh was actually one of the first countries that started using ivermectin. Dr. Alam over there was the first who started doing some of these researches. And we'll hear from Dr. Wasif Khan as well more. So Dr. Wasif Khan, please take it away. Welcome.
Thank you very much, Dr. Mubin, for giving me the floor. First, can you hear me clearly?
Absolutely.
Okay. So first, I'd like to thank the organizers for organizing this very interesting for the last year that I'm hearing this international conference on ivermectin for COVID, and for me as a speaker and to share some experience from Bangladesh. Next slide, please. So my presentation will be basically two-part. First, I will share the randomized clinical trial that we conducted in mild COVID patient, hospitalized patient. And after that, some experience of ivermectin that's at present that's been going on. So to start with, actually, just to give you some background, that it was in March of, 8th March of 2020 that the first case of COVID was reported from Bangladesh. By that time, already there has been a huge news that we have been hearing from CNN and BBC in USA and especially in Europe, Italy, Spain, a lot of cases, and lockdown has started. So as soon the first, within 2 weeks, the Bangladesh government planned to go for a lockdown from 30th of March for 2 months. And we from my institution at ICDDRB and with the local pharmaceutical, we met soon after within the first week of first reported cases that we really need to do something for this country, as you know, the containment strategies and patient management varies from country to country, and it depends on the resource availability. So we have limited resource, so what can we do? So apart from what WHO has been recommended for social distancing and hand wash and mask wearing, so what else we can do? So for that consideration, actually, we thought that we should go for looking for the therapeutic trial, and we should look for a clinical trial of a drug that is easily available and locally manufactured, is effective, good safety profile, and low cost. And by that time, already Kelly's paper was on the ground, Melbourne. So we thought that ivermectin should be one of the choice that we should be doing, and it's already been FDA approved. And we, at that time, actually, we decided that single dose is not really going to work against this. We have to, because of its short half-life and also some animal studies, we have found that to get a high concentration in the pulmonary tissue, it needs a higher dose for a longer period. In animal studies has shown a 3-fold higher. So considering all these points, we decided that we'll go for a 5-day course. Can I have the next slide, please? So the study objective was, actually, it was primarily the days required for remission of fever, cough, and sore throat, and the viral clearance timing. And the secondary objective includes a requirement of oxygen, patient failing to maintain peripheral oxygen saturation more than 93 despite oxygenation, number of days on oxygen support, total hospitalization, and all-cause mortality. Next slide. So the study design was, we recruited patients from public hospitals, because you know that more than 90% of the patients do attend the public hospitals. So from the patient trials, patients were recruited, informed consents were obtained, and eligibility criteria were assessed. Nasopharyngeal swabs for SARS-CoV-2 were looked for that, and blood assessment, routine blood, the liver, kidney, and CBCs were checked. And if they fulfill the criteria, then they were enrolled and randomized. And during that, they were hospitalized there. And the study drug, they were administered, the vital signs were taken every 12-hourly, blood markers were checked. And at least the patients were kept for 8 days before they've been discharged. Even if they're, and afterward, it was totally after 8 days, it was patients, physician's discretion when to discharge them. There was a follow-up at day 14, and at day 6 weeks after, there was a telephonic follow-up. Next slide, please. So we had 3 treatment arms. Group A, 12 milligram ivermectin single dose with 200 milligram stat dose of doxycycline on day 1, followed by 100 milligram of doxycycline 12 hourly for 4 days. As Dr. Mubin said, that already by that time, actually, Dr. Tariq Alam, he did some observation study in his hospital. So already there has been some interest on ivermectin and doxycycline. So doxycycline was considered in our trial also. And the interest for us was that to look for a 5-day longer course of ivermectin, that is the group B. We gave 12 milligram ivermectin once daily for 5 days. All these were given after taking food, and a placebo. So it was a double-blind placebo control. So there were 3 drugs. So it was exactly, it was made like a similar shape, size. So there's no way that any patient of the physicians, nurses, or the patient could know patient are in which group. So next slide, please. So the standard care was as per the national guideline of the clinical management of coronavirus that we had at that time, this version 5. As we know, the standard thing was paracetamol, antihistamine, antitussive, oxygen therapy, and these were all been given, and that was the practice that was going on at that time. So that was the placebo group received this treatment in addition to the drugs, placebos. Next one. So inclusion criteria were age between 18 to 65 years of either sex, and on enrollment, they have to have at least one of the following sign or symptom: temperature 37.5 degree or above, cough or sore throat, peripheral oxygen saturation at least 94%, duration of illness not more than 7 days, no oxygen support at the time of enrollment, capable to swallow oral medication, PCR were positive SARS-CoV-2 virus, and informed consent were obtained. Just to remind you that this was the early phase when we started that trial. So obviously the patient who were, anyone was positive, they were kept in institutional management were done, especially in the hospitals. So it was possible that mild cases we could enroll and kept in the hospital. Next slide, please. So the exclusion criteria, primarily any allergy or potent drug-drug interaction. If we knew about ivermectin, they were not included. Any chronic illness like heart, liver, or kidney were excluded. Pregnant or lactating mothers were not taken into the study, and any patient who were enrolled in any clinical trial in the past 4 weeks or have received ivermectin or doxycycline in the past 7 days were not included in the trial. This is just a flow chart to show the whole study procedure, just to give you a glimpse that after the screening in different days from day 1 to day 13, what are the different activities that we did over the patients. And then at day 14, there was another follow-up, and day 6 weeks after this, there was a telephonic follow-up, just to give you an overall the different activities that we conduct in different days. Next slide. So next slide, please. This is the recruitment, total recruitment. You can see that total 113 patients were assessed for eligible. Of them, 41 were excluded for different reasons. Mostly it was COVID negative, I mean SARS-CoV-2 negative in 30 cases, and others had some other issues like liver high G6PD or creatinine level, and one didn't give the consent. So ultimately, there were 72 patients who were enrolled, which were equally divided into 3 treatment arms, 24 in each group. But during the hospitalization, there were 4 patients actually who withdrew their consent. Of them, 2 were in the 5-day ivermectin, and 1 each in the ivermectin, doxy, and placebo group. So in total, there were 68 patients who were evaluated. Of them, 22 were in the 5-day ivermectin, and 23 each in the ivermectin, doxycycline, and in the placebo, there were also 23 patients. Next slide. So this table basically shows the baseline demographic and vital sign of initial 72 patients that we enrolled. So you can see the different characteristics. The age, median age was around 43 to 45 years of age. Female were a little bit higher than male, more or less similar. And these are the we can see the vital signs were all comparable between the 3 treatment arms, there was no statistical difference. The pulse oximeter on admission was on an average more than 95% in all the 3 treatment arms. Next slide. When we look the baseline clinical history among the patient, the most common signs symptoms that are associated with COVID are shown on the left: fever, cough, sore throat, shortness of breath, dizziness, loss of smell, and fatigue. These were all comparable, and there was no overall statistical difference. Although we can see in the there was only in the dizziness and loss of smell, there was relatively more patient we found in the ivermectin group compared to the other. We also looked some other variables, like as you can see in the footnote, body ache, BMI, joint pain, headache, nausea, loss of taste, and these were also comparable between the 3 treatment arms. Next one. Now, when we look the comorbidity, since these were mostly young cases, as you see, the median age was 45 years. There was not much comorbidity there. There were 32 patients who had, out of 72, there's 42% had comorbidities, which were again comparable between the 3 treatment arms. And among the comorbidities, the most common was 53% was diabetes, 41% hypertension, and 25% bronchial asthma. So there was no difference in comorbidities among the 3 treatment arms. Next one. Now the findings. So this Kaplan-Meier estimate of clinical symptoms here, actually I have merged fever, cough, and sore throat all together. And as you can see, proportion of recovered in y-axis over the 7-day period. So the rate of recovery was almost similar among the 3 treatment arms. Log-rank test was not statistically different. From day 5 onwards, as you can see, the green shaded line, which is 5-day ivermectin, shows a little bit better response compared to the other 2. But obviously, since the numbers were very small, we didn't get any statistical difference, but it was comparable. The clinical responses were comparable. However, next slide, please. When we compare the same, next one, please, next one. When we look into the Kaplan-Meier on the SARS-CoV-2 clearance rate, it clearly shows a significant difference. So basically, first I would like to say that PCR were done on admission, day 3, day 7, and day 14, not in every day. And what we found that clearly patients who were in the 5-day ivermectin, from the day 3 onward, they were showing a earlier clearance rate. As you can see, by day 7, almost 50% had virus clearance, 11 were cleared out of 22. And by day 14, it was almost 75% who were cleared, compared to it was about 50% in ivermectin doxycycline, and it was about 33% with placebo group. So that was clearly that virus clearance, as we have heard from the first presentation today, also from Israel. Professor Ilya has said the similar thing, which we also found that virus clearance was much faster with 5-day ivermectin. It was statistically significant log-rank test, you can see, and also when we compare with ivermectin doxy with placebo, it shows a significant difference. Ivermectin with placebo with ivermectin. Next one. We also did the Cox proportion hazard regression comparison of SARS-CoV-2 virus clearance on day 3, 7, 14 among the treatment arms. Here, we compared the ivermectin 5-day with placebo, and you can see on day 7 and day 14, the hazard ratio was 4 times and 3 times faster, higher with ivermectin 5-day compared to the placebo, the times higher in the virus clearance, and which is also statistically different, as you can see the red highlights in the extreme right column when we compare ivermectin with placebo on day 7 and day 14. Next slide. We actually also measure, like Professor Eli, the viral load count, CT value, as he has clearly mentioned, the CT is the nucleic acid cycle threshold among the 3 treatment arms. So on baseline, it was comparable, as you can see, the numbers are there. By day 7, as the viral load coming down, the CT value went up. And in day, the patient who were with 5-day ivermectin has significantly higher CT value compared to the placebo group, which was statistically significant. Similarly, on day 14 also, we got the similar trend. So and as you know, the lower the viral load, the CT value goes up, and with the CT value low means that you have the higher viral load count. So it is clearly shown that 5-day ivermectin shows a earlier clearance as well as the viral load also reduces, which is very important for public health point of view. Next slide. We also did some few biomarkers actually in this study, blood biomarkers comparing before and after the treatment between the groups. So if we see the first group within the 5-day ivermectin, the C-reactive protein compared to the day 1, which was 2.2 milligram per deciliter, is dropped by day 7 to 0.3, which was statistically significant. Lactate dehydrogenase also from 313 unit per liter, it dropped to 264, also statistical difference. But however, when we compare with the ivermectin and doxycycline between their day 1 and day 7, there was no statistical difference. In the placebo incident, interestingly, we got it a difference. It was within the lactose and hydrogenase drop. We also looked at procalcitonin, there was no difference. And ferritin also, it started dropping, and we can see it's close to significant. It was not significant, but it was very close in the ivermectin, that from 268 nanogram per ml, it dropped to 211. So clearly the biomarkers also showed, but as I said, that since the numbers were very small, we really couldn't show a big difference. But there's a clearly trend it shows here. Next slide. So in summary, we can say the median duration of SARS-CoV-2 clearance was significantly higher in 5-day ivermectin arm compared to the placebo. It was 10 days versus 13 days. In ivermectin and doxycycline arm, it was 12 days. The blood biomarkers, which interpret the disease severity of the infection, CRP and LDH, significantly dropped, and ferritin was near to significant after 5-day ivermectin treatment by day 7. And the viral nucleic acid cycle threshold value, indicator of viral load, significantly increased by 5-day ivermectin compared to the placebo on day 7 and on day 14. So it clearly shows that there are benefits, and I didn't mention anything with the side effect. There wasn't any major side effect that we have come across. There were some mild cases of itching, rash, nausea, vomiting that happened, and it was also comparable between the 3 treatment arms. And actually, it came out in the International Journal for Infectious Diseases in November 2020. Next slide, please. So now I would like to touch a little bit about the present experience of ivermectin. Can you just click? There is some animation, so one after another. Just hold at this point. Yeah. So first of all, our country, Bangladesh, is a small, tiny country. As you can see in the bottom, is 150,000 square kilometer size, which is, it has been said that the size of Wisconsin state of USA. But population-wise, it is it's not 163, it's over 170 million now, which is almost half of USA. You can see, so such a small country with a highly densely populated country, and it's surrounded by India in 3 sides, and in the south is Bay of Bengal. On this right side, I've tried to put a graph where I have picked the 10 most populated countries which have a population of more than 100, and also on the y-axis and the population density with square kilometer. And you can clearly see the Bangladesh way above than any other country. And thus a country like this, where just public health measures, what WHO is recommending, is really not possible. And we really have to do something more than that of doing. And probably that is why we have come here today to talk about ivermectin, which could be a good thing, because as I go to the next slide, it will be more compelling to say why ivermectin is so important. The next slide, please. So this is just to give you an idea of Bangladesh, the COVID situation. As I said earlier, that first case reported on March 8th of 2020. We had the peak in June, July, August of 2020, and there is gradually came down almost below 5%. It was just few hundred cases in January, February, March. But again, from end of March and April, it has shooted up now. And right now, what we have been, from my institution, it's been reported that the South African variants, it's almost 81%. They got it. That is now mostly prevailing in here. The death rate has also gone up. Today also we had, for the first time in this month, actually, we had more than 100 deaths occurring in the consecutive 4 or 5 days now. In between, there was 2 days where I had a little less than 100, but again, today it's again above 100. So severe cases are really going up nowadays. On the right is just showing the positive detection rate, and it's a similar It was 20 to 25% the first peak, and again, it's going up. And right now we are having a lockdown for the last 2 weeks, but in the real sense, it's not a real lockdown. It's I would say, a semi-lockdown. There's some shops are open, the businesses are going on, and people seems to be less scared compared to the last year because they don't know what to do. But even a lot of people are not really wearing masks. That I would definitely. The next slide, please. Well, this is a slide that I just wanted to share that ivermectin sale in Bangladesh. These are top 8 pharmaceutical companies. You can see the list of the name and the brand name. Here, actually, this data in Bangladesh is one of the hub for generic drug production. There are 257 licensed pharmaceutical companies. Of them, 150 are functional. From IMS, what we got the information, I've compared in this table the total sale of ivermectin of 2020 compared to the 2019. You can clearly see that the sale of ivermectin has tremendously gone high in 2020 compared to the 2019. And interestingly, if you see, there were 1, 3, 5, 6 companies who never had any product of ivermectin in 2019. But here, the top one, which is Beximco Pharmaceutical, they have over $1 million sale of ivermectin, whereas they didn't have this product in the market in 2019. So it's clearly that can give you an idea that how much use of ivermectin is going on in the community, and especially with Dr. Tariq Alam's initial observation and followed by this paper that came out from ICDDRB. Next slide. So this is actually basically, this slide is showing already a number of local pharmaceuticals have made brochures of ivermectin using against, to use ivermectin against COVID-19 as an off-label use, which is permissible by the local regulator. Although the regulator has not yet approved ivermectin as the indicator for COVID-19, but its rampant use is going on in the country. And you can see the brochures are already been out. So I just want to touch here that here in Bangladesh, actually, the situation of the vaccine is that from 7th of February 2021, the Covishield vaccine from Oxford AstraZeneca produced by the Serum Institute of India has been started. But as you know now that with the sudden upsurge of COVID-19 in India, they have temporarily stopped exporting vaccines. So that has been a big blow. The government is really concerned. So far, 5.7 million first dose of vaccines have been given in Bangladesh, which is just a peanut, 3% of the total population. And we are not sure about when the next vaccines will be coming because the existing vaccines, we are hearing that within the next 12 days is going to be exhausted. So with this thing, I think under this precarious situation, I think the role of ivermectin as prophylactic, as we have heard earlier from the other speakers, and also for treatment at early stage can play an important role for Bangladesh. With that, I'd like to end my presentation. Thank you.
Dr. Wasif Khan, thank you so much for such a wonderful, such a rich presentation, lots of data. And once again, Bangladesh has been the trailblazer. We are for example, in the countries like US, we are sitting here and actually seeing how Bangladesh has been groundbreaking. So thank you very much for your work here. A couple of questions that we have been receiving. So one question is, it is from Laura. She's saying, Dr. Khan, do we give ivermectin to patients with BCG or cholera vaccine? Can you explain the concern, if there is any concern?
Well, as Dr. Corey has earlier has mentioned that, Pierre Corey, that there are contraindication, but I haven't come across, or Dr. Tariq Alam hasn't said anything, because cholera vaccine is not that commonly been used in Bangladesh, so it's not been available, but I don't know if somebody else can make this recommendation or what.
Got it. So yeah. Laura, I don't think that there is a big concern. If there is a specific reason for the concern, can you please put that and we can then see if we can comment on it. Okay. Dr. Khan, next question. This is from Dr. Nijon Ekles. I hope I'm pronouncing your name correctly. Why do you think there was less viral clearance in the ivermectin plus doxycycline group compared to ivermectin alone?
Well, as I said in my background, that probably the higher dose would have been much more better in clearance than the virus and in the single dose may not be good enough. It may not be enough to clear the virus. So probably that would be the
Got it. One more question. This is from German patron. Dr. Khan, do you have any experience to use ivermectin until respiratory symptoms decrease more than 5 days in older than 64-year-old or with specific oxygen saturation lesser than 94%? I guess the question is, can we use it beyond 5 days?
I think, beyond 5 days, there are some papers have come out that they have been giving for a longer period, but since we did the study for 5 days, obviously.
You are, of course, totally makes sense. And just German, my personal experience is not a study. I continue to work with my patients when I start ivermectin. I go on until their oxygen levels improve or their condition, clinical signs and symptoms improve. I do not leave it. What I have observed is if you leave it in a few days, patients, sometimes they bounce back. So this is just an observation from my own patients. Dr. Khan, continuing with the questions, a couple of more questions here. One question is, what is the situation now for ivermectin usage? So you showed some of the pharmaceuticals that they have ivermectins available. Are doctors using them? Are you using them? Do you feel any pressure that WHO said that, hey, don't use ivermectin? What is the general trend?
Yeah, well, I am talking from the Bangladesh point of view. Yeah, it has been used in many institutions, hospitals. They are using as a practice based, especially when the paper came out in a peer-reviewed journal. I know many private hospitals are giving this drug. But as I said, the regulators are basically, our regulators are mostly dependent on, WHO and FDA. Unless they don't approve on indication, they keep quiet. But people are using.
Got it. Thank you very much. And one last question. This is from Nasiba Kathrada. Bangladesh has been using ivermectin for a while, but they still have such a huge increase in the case number. Is this because ivermectin is not used as prophylaxis?
Yes, that's true, because this is not, as I said, that this has not been recommended. Only some few physicians, they are doing, like I know Dr. Alam is using and few others, but not in a, so that is what I've been hearing yesterday or today, that if something that BIRD can take an initiative, and I can help our regulators with them to talk, the lawyers, there are some lawyers who really work for this sort of issues that can come up, and they can take it to the higher authority to consider using ivermectin, especially when we don't have the option of vaccines coming very soon. And I also mentioned about the crowded, the concentrated population in this country.
Got it. So once again, Dr. Khan, thank you so much for your presentation, for taking the questions, for your time.